Thanks for joining us. I'm Sherilyn John, the Program Director for Stop on Suicide at the Dallas Veteran Resource Center. We're committed to providing suicide education and prevention to the community, reducing barriers to the information, decreasing the shame often associated with suicide, as well as reducing the stigma to access and treatment for mental health crises. Today, our goal is to provide you with practical information on how you can stop one. Let's get started. You might have seen images of the coronavirus, and while the disease is proving to be deadly for tens of thousands across the globe, the virus is also producing an environment rife with issues that impact mental health. Recently, CBS News reported a projected increase of suicide and death by drug overdose from 45,000 per year currently to 75,000. Isolation has long been a contributing factor for individuals struggling with mental health. The shelter-in-place orders further impact a person's willingness to seek help when they're struggling. And there's information. It also adds to the crisis and anxiety. And what I mean is twofold. On one hand, information regarding world events can be overwhelming, but we also want to take a look at the information that is lacking, information on how to identify a person or you yourself is exhibiting dangerous levels of stress and to be equipped to engage individuals, helping to better manage emotions, cope, and possibly seek help. The third critical thing to the military veteran population is access to legal means. Statistics show that while veterans represent only 1% of the population, they are 20% of suicide. Why? Because 70% of the time, veterans choose the most lethal means of suicide death, firearms. The Stop One Suicide program started with a phone call, with social distancing limiting in-person contact. Being able to hear distress and ask the right question is imperative. Would you know how to respond? After today, we're hoping you will. This Time magazine cover was meant to galvanize the nation and the Veteran Administration to action over the statistic. One was considered a worthy headline, and indeed it was. Even the dictator Joseph Stalin often credited with the statement, "The death of one is a tragedy. The death of millions is a statistic." Stalin and others recognized that the more numbers increase, the less likely individuals, politicians, and nations are willing to act. Statistics have little impact and quickly become forgettable. Even now, as we're facing a global crisis, news has gone from repeating rising numbers every day to such a commonplace occurrence. Few are listening, and even less are acting on the collective good of others. In 2012, the editors of Time magazine could not have imagined the real numbers once they were revealed. Almost one veteran an hour dies by suicide, a number that should take the breath away of every freedom-enjoying American. Before we move on, let's take a look at this current statistic. The American Foundation for Suicide Prevention has determined that for every completed suicide, there are 20 attempts. The statistic calculated is over 200,000 military personnel have self-directed harm each year. Even the number of 20 veterans a day means 500 veterans every day are battling suicidal ideation. 20 every single hour. The toll suicide is taking on families and friends is also hard to fathom. And if those numbers don't align, just look at the projections. Using the same parameters from the American Foundation for Suicide Prevention, for every completed suicide, there are 20 attempts. The projected increase would mean over 300,000 self-directed harm occurrences. Here's what you need to know. Have resources. It's important to have resources at the ready. Please take out your phone or a piece of paper and add these numbers. You might be familiar with the suicide crisis line, 800-273-TALK or 800-273-8255. Veterans press 1. But we also want you to know and make you aware of the Disaster Distress Helpline. That's 800-985-5990. This number is implemented in areas where a national disaster declaration has been made. So in the past, it was used during hurricanes or tornadoes or other scenarios to help citizens experiencing high exposure to trauma with arising mental health issues. So if the trained personnel determines the caller is facing suicidal ideation, the call is escalated to the crisis line. We also want to note that the crisis line can be called by anyone. If your friend or loved one is in a crisis, you can call and receive guidance on the next step. The important thing is make the call. Thomas Jefferson, the great statesman and founding father of the nation, said, "Who then can so softly bind up the wound of another as he that has felt the same wound himself?" You can make a difference by having an open and frank conversation on the subject of suicide. Veterans with lived experience of suicidal crisis, along with the lived experience of loss, can make a difference by having a conversation. I've encountered health professionals that would whisper suicide like it was a source of secret shame. No one is whispering diabetes or heart disease. It's time suicide was said without shame. I might have dated myself using the cult classic Lost in Space. The robot's warning to unsuspecting Will Robinson illustrates what you don't know, you don't know. And we want you to know how to identify crisis and act. Signs of crisis are displayed in 3 ways: talk, behavior, and mood. So we've prepared a PDF of the warning signs that you can download on our website, along with many other downloadable resources. Many people who are suicidal talk about ending their lives. This might be directly or indirectly. A person might say it outright, or they might joke about it, but take it seriously. Some people say they have no reason to live, and others might say things that let you know they are feeling trapped or that they're feeling like they're a burden to others. They might talk about feeling overwhelmed or being in unbearable pain. Behaviors that are atypical for individuals should also encourage you to speak to the person about what you're noticing. People thinking about suicide can display certain behaviors. There may be an increased use of drug or alcohol. They might have trouble sleeping, either experiencing insomnia or sleeping too much. They might start acting recklessly. They might withdraw from activities, especially things that they normally enjoy. They might isolate themselves from family and friends. They may also start looking for ways to kill themselves online, such as searching for different methods or shopping for a firearm. They also may give away their possessions or show other related behavior like reckless spending. People at risk for suicide can display, often quite subtly, any of the following moods: depression, apathy, rage, irritability, impulsivity, humiliation, anxiety. Moods one would expect of someone who feels overwhelmed and desperate. Look, we all have our ups and downs. But when you notice a change that seems uncharacteristic or concerning, it's important to speak to that person about what you're noticing. For example, sudden unexplained happiness can indicate the individual's decided on a plan and is relieved that they're no longer will be in pain. And that's a lot of things to look for. So to sum it up, look for changes in behavior and trust your instincts. Assume that you're the only one who's going to reach out. And in too many situations, People talked about their concern for someone amongst themselves, but they were hesitant to reach out to that person directly. So here's the rule of thumb. If you're wondering if somebody is depressed or overly anxious, that's a sure sign that you should reach out. And the same goes for you. If you're having suicidal thoughts, that's a sure sign that you should seek help. And if you've reached out again, reach out again and again. The first time the person might not be receptive, so keep trying. And for yourself, try talking to someone else or a professional. And even if suicide turns out not to be a concern, they still might be in distress. And they might feel comforted just knowing that you care and support them and are taking time to listen. Knowing that support is out there is so important. Letting somebody know your concern allows them to share what they're experiencing. And a conversation is always a good way to show that you care, as well as allowing you to gain more information about their level of distress. Have that crisis line ready and the disaster helpline. Have those numbers at hand. So how do you reach out to someone? Talk to them in private. Listen to their story. Express concern and caring. Ask directly about suicide. And don't be afraid to ask the question, are you thinking about suicide? Encourage them to seek mental health services. And if they're in a crisis, take them to help. There are some things to avoid when talking with someone who might be suffering from depression or anxiety. Avoid minimizing their feelings. Those of us who have never experienced major depression literally cannot imagine what it feels like. Avoid trying to convince them that life is worth living. If a person is nearing a crisis point, they're clearly not thinking about having a philosophical debate about why life is worth living. And those kinds of conversations tend not to be helpful. So avoid advice to fix it. If a person's having a heart attack, you wouldn't tell them to start exercising or eat a healthier diet. If they're in a crisis, what they need is to be heard and then led to help. Listen to their story and help them find a professional. Help them take active steps towards keeping their environment safe. You would not hesitate to call for help if you feared someone was having a heart attack. So don't hesitate to make the call to the crisis line. If you think they might make an attempt on their life soon and you're with them, don't leave them alone. But however, if the situation puts your life or someone else's safety at risk, call 911. Help them remove access to lethal means or remove themselves from the dangerous area like a bridge or a motor vehicle. Go with them to a mental health professional or an emergency room. These two graphics show the real and present danger for veterans experiencing a mental health crisis or suicidal ideation. 68% of the time, male veterans are choosing firearms, and female veterans are choosing firearms 41% of the time. All other methods combined are only 5% fatal, while firearm injury is 90% fatal. Data has proven that putting 10 minutes from access to lethal means and suicidal ideation saves lives. We understand that veterans may never give up their firearm, but you can have a conversation about locking them up, putting the key in a plastic bag and in a jar of mayonnaise or a pickle relish or jam or frozen in an ice cube. The important thing is time. Have an interruption from suicidal ideation to that access to lethal means. Know the signs. Download your free PDF of suicide warning signs. Have a conversation. Trust your gut. You might be the only one who'll reach out to that person. Seek help. Don't hesitate to call the crisis line at any time. Talk and time saves lives. The statistics are numbing, but To focus on one, which may be you, matters. You can be the one to stop one. If you didn't note the crisis number in the disaster distress line before, here's another chance before we conclude. Remember that either number can be called by anyone. If your friend or loved one is in a crisis, you can call and receive the guidance on the next step. The important thing is make the call. All of our classes are available to conduct virtually. Visit the website to see the complete list of offerings. Connect with us online to stay updated on scheduled virtual classes. We're here to help you stop one. We began the presentation by bringing to light a mental health crisis on the horizon due to COVID-19. Issues of isolation, exacerbated by the shelter in place, along with stay home and stay safe, information, too much about politics and pandemics, and too few people knowing how to identify and understand a mental crisis, and of course, access to lethal means in the military veteran population. We hope you're more informed and equipped to be ready for the days ahead. The statistics brought out can be overwhelming. You might have thought there wasn't much that you could do to make a difference. But there's an ancient Hebrew saying that says, if you save the life of one, you have saved the world entire. We will work to stop one. 5-1-5-1-5-1, a redemptive and recovering people empowered. Help one. By engaging with just one, you can make a difference. Acknowledging the humanity of all you meet makes a difference. You can be the difference. You can stop one. Be sure to visit the website. Thank you for your time. Well, working together, we will stop one.